All right, another great panel. And our next panel is going to be on a very timely topic, which is AI in healthcare, artificial intelligence in healthcare. This is a topic that seems to have come up to about every conference I've been to over the last 2 years. Yet I will admit that I still don't fully understand, or even really partially understand, what this whole concept of what AI really means in our industry and how it's going to change our industry. I do know some of our partners are investing so heavily in AI that it's unimaginable that that we don't pay attention to this. So we did put together a great session here today. I'm going to bring up Tom now. What's that, Tom? Edmund. Oh, that's very helpful. I don't have to read off of this. Edmund Lau is a member of our fantastic Asia Pacific Regional Steering Committee. He is an esteemed associate lecturer at universities in the US, the UK, Australia, Singapore. I'd like to have his air miles, that's for sure, and other international learning. Why don't you come on up, Edmund, who's going to take over this panel and teach us all about AI in healthcare.
Thank you. Thank you very much, Andrew.
Thank
you can
you.
have my air mouse. Ladies and gentlemen, are you excited about the future? Are you excited? All right, that should be the way. Your Excellency, President of WPA, Mr. Andrew Spiegel, and of course, our Executive Director, Dr. Hussein Jeffrey, our member organizations, and future potential member organizations. If you have not signed up, please sign up soon. And of course, not forgetting our friends online. My name is Edmund. I'm from Singapore. I am also a psoriasis patient. So I'm associated with this organization in Singapore called the Psoriasis Association of Singapore, and it was founded in 1982. And we are still learning, not just in Singapore, but everywhere in the world. So let me just do a quick introduction of my session. AI, or artificial intelligence, has the potential to revolutionize healthcare by enhancing diagnostic accuracy, streamlining administrative tasks, and improving patient outcomes. AI-powered tools can analyze vast amounts of data quickly, helping doctors make more informed decisions, personalize treatment plans, and predict disease progression. From early detection of illnesses to optimizing hospital workflows, AI is transforming the way healthcare providers deliver care, allowing for more efficient, accurate, and patient-centered approaches. As AI continues to advance, its integration into healthcare will undoubtedly lead to better access, innovation, and outcomes for patients like me and many other psoriasis patients in millions globally. So with this, let me do a quick introduction of my moderator. So let me introduce to you my moderator. Thank you. Nicole Shehan. So she's the president of Global Colon Cancer Association and has held leadership positions at the Colorectal Cancer Alliance, including Chief Development Officer and Chief Operating Officer. Inspired by her mother's death due to cancer, she has dedicated her professional career to health and human service organization. Without much delay, let's welcome Nicole. Thank you.
Thank you, Edmund, so much for your energy. Just now I feel like I need to bring it. It's 3 o'clock, so I feel like I just came off the sugar high from that wonderful dessert with lunch. So yes, thank you for your energy. I'm happy to be with you today as a moderator for this panel. Like Andy said, I've also been seeing so much talk about AI, and I'm thrilled to be a volunteer of the World Patients Alliance, and I'm so encouraged at all of the opportunities that patient advocates have to be a part of the AI discussion. I feel like it's critical that we're not left out of this. So very excited to be here with you today. We have three speakers that will be presenting today. Our first speaker will be virtual. His name is Anupam Kashyap, and he's with Cure MD. Our second speaker, who I'd like to invite to the stage now, is Ravi Prasad with the University of California. And our third speaker, who I'd also like to invite to come up, is Victor Moreno, and he's with the Global Allergy and Airways Patient Platform. Anupam Kashyap.
Can everybody?
Oh, sorry.
Go ahead, sorry.
Sorry
I
about
wasn't
that.
sure when.
Oh, and I just heard this voice from above, and I thought you were in the room, so it kind of scared me, to be honest.
It's all AI,
It's all
not me.
perfect segue. Oh, that really did scare me. The Vice President of Strategy at CureMD, a leader in healthcare technology innovation. With over 20 years of experience in strategy, product, and operations, he has driven initiatives that address critical challenges in healthcare, focusing on improving patient outcomes and enhancing system efficiencies. Ravi Prasad is a psychologist by training and currently the clinical professor and director of behavioral medicine at the Davis School of Medicine. His clinical work focuses primarily on evaluation and treatment of individuals suffering from acute and chronic pain conditions. And last but not least, Victor Moreno is currently the Vice President of Awareness and Operations at the Global Allergy and Airways Patient Platform. His experiences in the area of patient advocacy has provided him with a high degree of knowledge of the socio-demographics, health access, and cultural specifics of the regions of Europe, Latin America, and Southeast Asia. So with that, I'll turn this over to Anupam Kashyap, also the voice from above, to kick us off.
Thank you so much. Hello, everyone. I'm Anupam Kashyap, and it's an honor to be here with you today. Virtually, I wish I was in Cape Town. I bring over 20 years of experience in healthcare technology, specializing in strategy, product, and innovation. You must have heard a lot about artificial intelligence or AI. But what exactly it is? AI refers to technology that displays behavior that can be seen as mimicking human-like intelligence. What's great about human intelligence is that there isn't one kind of intelligence. Some of us are great at learning new languages. Some are great at math and science. Some are great at art. Someone great at math may be a terrible artist. And a great artist may be a terrible at math. Each of us can be intelligent in our own ways. There is no one definition of intelligence, which makes it difficult for us to look at a robot or a machine or a system or a platform and say, that is intelligent. But one thing we have learned about computers for sure is that they are great at crunching large amounts of data very quickly, faster than us. They are great at recognizing patterns, and they work well when there are well-defined rules. So machines learning from data to assist us make predictions and decisions is a big part of AI. So I think to begin with, AI will do well in industries and organizations with well-defined rules and a large amount of data to learn from. According to World Economic Forum, globally, healthcare produces about 2.3 zettabytes of data, or about 2.3 trillion DVDs of data, and 97% of it is not used. In healthcare, AI is meant to assist doctors in providing more efficient and accurate care. It is meant to empower patients to play more active role in the health and well-being, to empower policymakers and public health agencies to predict, prevent, and manage events like COVID much more efficiently and effectively. It is meant to assist in discovering new therapies and cheaper. But AI is already playing a role, whether through improving diagnostics, streamlining operations, or patient education. Let's look at some real life examples of how AI is in use for diagnostics. AI in medical imaging by Google Health is helping doctors at Northwestern Medicine in US interpret X-rays and MRIs faster and with great accuracy to detect cancers and other diseases early, which can make a huge difference in patient outcomes. Similarly, Arvind Eye Hospital in India partnered with Google's DeepMind to develop a system that scans retinal images to identify signs of retinopathy. A country with limited resources and limited access to ophthalmologists, AI can help prioritize patients who actually need urgent care. Now let's look at how AI is being used in treatment. So let's start with Mayo Clinic, which in 2023, just last year, implemented an AI-powered clinical data analytics platform in partnership with Google Cloud. This platform uses AI to analyze vast amounts of patient data, everything from medical records to real-time clinical data, helping doctors personalize treatment for complex cases like cancer and cardiovascular diseases. What's really exciting here is that platform's ability to offer real-time treatment recommendations based on predictive outcomes. This means that for patients with highly complex conditions, doctors can now weigh different treatment options much faster and with great accuracy. By streamlining the decision-making process, Mayo Clinic has been able to improve both the speed and precision of treatments, enhancing patient care in some of the most challenging cases. And I think the complex diseases are the areas where it will help most. Another example is an AI company in South Korea called Vuno that introduced a new system designed to predict cardiac arrests within 24 hours of patients being in the general ward, using only 4 vital signs. This system is being used across clinical settings in South Korea and Southeast Asia, where it has already been a significant, champion of impact. This kind of early intervention is key in preventing cardiac arrests. Next, Tempus launched an AI system earlier this year to help doctors better match cancer patients with. Finding the right clinical trial can be a life-saving for patients with rare and complex cancers. And I know it because I lost my mom to cancer. But it's often difficult for doctors to sort through available data to find the most suitable options. This AI system analyzes a patient's genetic data and treatment history, then recommends clinical trials that align best with that specific cancer type and the stage of cancer. This has been particularly valuable in helping oncologists offer their patients more personalized care and cutting-edge treatments when all conventional therapies have been exhausted. So by improving access to trials, the Tempus AI platform is helping doctors guide patients to treatments that might offer them a chance to live. In these examples, Mayo Clinic's data analytics platform, Vuno's cardiovascular risk prediction system, and Tempus's AI-driven clinical trial matching, we see how AI is already being used to enhance patient care by helping doctors make faster, more accurate treatment planning, allowing clinicians to offer personalized, data-driven care that ultimately improves outcomes for patients, especially in complex and life-threatening cases. Now, AI chatbots are also revolutionizing healthcare by giving patients 24/7 access to reliable, personalized health information. ADA, for instance, is a symptom checker that uses AI to provide tailored recommendations based on patients' responses to a series of questions it's asked, guiding patient to the right path. The right path could be self-care, right path could be talk to the doctor, right path could be go to the urgent care. So it's directing that. Meanwhile, Healthily offers an AI-powered search engine that provides science-backed medical advice, ensuring users get accurate information rather than relying on unverified sources and Google searches on diseases and conditions. By making healthcare information more accessible, tools like these empower patients to make informed decisions and improve both patient education and health outcomes. Now, AI is also working in other areas like remote patient monitoring, drug discovery, better resource allocation and preparedness. For example, the patients with chronic conditions like diabetes and hypertension and heart disease, AI-driven remote patient monitoring systems can detect patterns in data collected from wearables that are continuously measuring these vitals at home, alerting doctors in real time if something is wrong. That also reduces the cost of delivery from patients being managed at home versus inexpensive and often, of exposure to infection in hospitals. AI is also transforming drug discovery by reducing the time from years to months, which could lead to faster approvals of life-saving therapies. So AI is revolutionizing drug discovery by accelerating the identification of new drugs, as well as repurposing some of the existing drugs for new use cases. In 2023 alone, AI-driven platforms significantly shortened the time to discovery of diseases like cancers and fibrosis, helping researchers identify potential treatments faster and more cost-effectively. Hospitals are also using AI to streamline workflows, from scheduling to managing bed availability to even predicting demand of hospitalization. This makes healthcare more efficient and reduces wait time for patients. Now, I want to show you what we are doing at QRMD to implement AI for doctors across multiple specialties. So now, with training data on AI, medical data, we can accurately predict the disease progression for a patient. So in this example, you see that this patient had constipation that developed into hemorrhoids. The disease can then progress to GERD, and if untreated, it can progress to gastritis, which may eventually lead to benign neoplasm of colon. Now, if we could predict this and prevent it by timely intervention, doctors can avoid this patient to go through this complex condition. Now I'm going to flip the coin. And what if we can trace any cancer backwards? What are the factors that are leading patients to a colon cancer? This kind of analytics using AI can catch this much early and prevent other patients from developing these cancers. So AI offers the promise to use data analytics in new ways, leading to prevention and risk mitigation. It can help us shift from reactive care to proactive preventative care. Another area where we are implementing AI is ambient AI scribe. Now, we all know, and we heard in the earlier talk, that physicians don't have time to give you, talk about, your lifestyle and how to, prevent, diseases, but it's more reactive. And I don't blame physicians because there's just too much of overload of documentation and administrative burden. So what this AI scribe does is it can listen to doctor-patient conversations, of course, with their consent, and transcribe it, translate it, and even convert into structured notes that can be used to treat and manage the patients. So this not only saves time for doctors in documentation, etc., but it also enables doctor to give that personalized attention, undivided attention, and give that empathetic care that we all deserve as patients. Now, AI clinical assistants are also solving many of the repetitive problems. For example, a doctor can ask AI assistant, summarize all the previous notes for me. There could be years worth of medical history or notes for a patient. And within a matter of seconds, AI can summarize that to give a context to the patient provider about what should be important in the treatment options. You can ask AI assistant to detect trends, any changes over time by comparing notes, comparing records, even highlight missed preventative care, make recommendations based on the latest treatment evidence, and even predict hospital admissions or risk for a disease, or just ask AI assistant to suggest improvements to the current treatment plan. Another area where AI has been implemented accurately is disease prediction. We can predict major chronic conditions like hypertension, cardiovascular disease within 1 to 5 years of time. And also by giving providers the explanation of what are the contributing factors, it builds trust and it facilitates an informed discussion with the patient to develop a plan to prevent or minimize that risk of developing that chronic condition. In many parts of the world, access to healthcare specialists is limited. AI can help fill that gap by assisting non-specialists in making informed decisions in specialized areas of medicine. For example, AI tool can help diagnose a disease in a rural or remote area where specialized doctors are not available or they are scarce. AI-driven translation tools are also helping bridge language barriers. These include patients and providers communicating effectively, even when they don't speak the same language. On a larger scale, AI is playing a vital role in public health sector too. It's used to track disease outbreaks, predict the spread of infectious diseases, and support emergency responses, something that's crucial for global health security. Now, AI adoption in healthcare also brings up ethical and practical challenges. One of the major concerns surrounding AI is the data privacy. AI systems require vast amount of personal data, patient data, raising questions about how to store that data, how to use that data. So as AI adoption increases, ensuring patient privacy and data security is critical. There is also a chance of bias in AI. AI systems are only as good as the data they are trained on. If the data is biased, the AI's recommendation could also be biased, potentially leading to unequal care. This is very important that we have to build a system that is fair and inclusive in our development practices. Finally, while AI is exciting, it's not yet accessible to everyone. Many communities, especially in low-income countries, don't have the infrastructure needed to benefit from AI tools. So we must work together to ensure AI doesn't deepen global health disparities, but instead help us to close those gaps. This is the future I see for AI in the short term. As AI evolves, it's going to play a major role in personalized medicine by analyzing an individual's genetic information, lifestyle, wearable data, and medical history. AI can help not only develop treatment plans, but also help develop self-management tools. Collaboration, not replacement. It's also important to emphasize that AI is just a tool. It's not a replacement for healthcare providers. The best outcomes will come when we collaborate with AI, when AI is augmenting the expertise of doctors and nurses. Looking ahead, AI will also be crucial in addressing global health challenges, from managing aging population to dealing with chronic conditions. AI has the potential to transform how we tackle these problems. I believe AI has the potential to make healthcare more efficient, more accessible, and more personalized. It's already improving outcomes for patients by helping healthcare providers do their job better. However, the future success of AI in healthcare depends on global collaboration. Policymakers, healthcare providers, and patient advocates must work together to ensure AI benefits all communities, not just a few. Lastly, AI is powerful, but it will never replace human touch in healthcare. Instead, it should enhance the ability of healthcare providers to offer compassionate and patient-centered care. I encourage all of you to stay informed about the developments in AI and healthcare. AI is still in its early stages, I believe, and your voice as patient advocates is vital in shaping how it evolves. As we move forward, let's ensure that AI is developed and implemented in ways that are equitable and that prioritize patient care and safety. We have an important role in ensuring we take a patient-first approach over a technology-first approach. Thank you.
Great, thank you so much. Am I advancing here or? Goodness. Thank you again for that very engaging presentation. We'll be doing questions at the end of the presentations. Next, I would like to invite Professor Ravi Prasad to come up for his presentation on ethics, promises, and the perils of artificial intelligence. Thank you.
All right, well, thank you all for being here this afternoon. There's going to be a bit of redundancy between the presentation that you just heard, my presentation, and probably my colleague's presentation afterwards. But redundancy isn't a bad thing. That just means that we're reinforcing a very important message. So as you hear that, please interpret it in that capacity. But I am going to be speaking about ethics, promises, and perils of artificial intelligence. And we'll start with the ethics piece. And so I'll start with just a very clear statement. First and foremost, there are no globally accepted ethical protocols and principles surrounding AI. Nothing like that exists at this present time. Within the US itself, the federal government does have a number of documents that they've put out to try to help guide the implementation of AI, and several of the different healthcare agencies within the US government have also done some of these things. And non-government organizations within the US have also put out some blueprints for how should we implement AI within healthcare systems. And this was meant to be not just for a clinical implementation, but also research implementation. And this particular coalition is an interprofessional group. So it's comprised of individuals representing a wide swath of folks involved in healthcare. And then again, within the US, a number of profession-based organizations, the American Medical Association, the Federation for State Medical Boards, American Psychological Association. Each of these organizations also has statements, policies, guidelines around how we should use AI, how AI should be implemented. In the European Union, the application of AI, the implementation of AI, again, same thing. There's no standardized process or a standardized set of guidelines for implementation, but really the guidelines vary depending on how AI is used. And when you take a step back and look globally, we see that many of the guidelines in terms of application of AI, they really relate to national security related issues, but not as much related to patient related issues or the person. So we don't have globally accepted protocols or principles. But this is something that raises a number of eyebrows. UNESCO recognized that this is clearly a problem. And rather than looking at, should we put some guardrails in place, should we not? UNESCO has moved to a position of definitely, we need to have some guardrails in place to guide the implementation of AI. But how should we do this? So in 2021, UNESCO was one of the first groups to put together a set of ethical standards to guide the implementation of AI around the world globally. And this was adopted by all 193 member states. And they had extensive policy action areas that allowed application of values and principles across a number of domains. And the foundational principle that they had at UNESCO was the protection of human rights and dignity through transparency and fairness. So something that probably resonates very strongly with our organization here. The Global AI Ethics and Governance Observatory was created through this organization to identify AI-related challenges, but also to try to address these challenges. What are ways that these things can be addressed in a proactive manner? My colleague before me had referenced the World Economic Forum. World Economic Forum, in partnership with AI Commons, hosted a global summit on generative AI in April of last year in my home state of California. This led to the Presidio recommendations, which was a document that contained 30 separate guidelines intended to facilitate generative AI advancing human progress. Their recommendations have three overarching themes: responsible development and release, open innovation and global collaboration, and social progress. And from that came the development of the AI Governance and AI Governance Alliance, the AIGA. And the goal of AIGA is beyond just guidelines, beyond just guardrails for the ethical implementation of AI, but it's really how can we advance AI? How can we make sure that this is something that's utilized to advance humankind, to allow everybody to prosper worldwide? And as of September of this year, the AIGA had 500 members from 350 organizations. And this is a partial list of some of the member organizations, or some of the partners rather. So what are some of the promises of AI? Some of these things you heard my colleague speak about earlier, so I'm not going to spend as much time going into detail about these things, but I'll touch on these things again and talk about some of these from a little bit of a different perspective than he did. But in my presentation, we can really break down into four categories, some of the clinical promises of AI: facilitating diagnosis, enhancing treatment, improving clinical efficiency, and increasing access. So first, with facilitating diagnosis, we heard in the earlier presentation about the role of AI in improving speed, improving diagnostic accuracy. There was a specific study that was done that compared a deep learning model, an AI model, that was trained to learn 14 different pulmonary pathologies. And they compared that AI model to 9 radiologists who had varying degrees of expertise, but all of them were experts in the field. And there were 420 images that were studied of these 14 different pathologies. And what they found was that the AI model had the equivalent performance to the 9 radiologists with 10 of the pathologies. It had better performance with 1 of the pathologies, and it had poorer performance in 3 of the pathologies. But what's most startling, the most powerful thing that came from this, is the average time. It took the radiologist 240 minutes to read the different images, whereas it took the AI system 1.5 minutes to go through all of those, right? So when my colleague before was talking about speed and how this can be effective, this can certainly facilitate diagnosis. But as we look at this, what it also shows us is we don't have to worry about AI taking anybody's job tomorrow, right? There's not a threat that that's going to happen. There's a lot of work to be done. Certainly when we see that there's worse performance in 3 pathologies, that's not something that's acceptable. And so it really reinforces that AI can be something that's a partnership in medicine, a partnership for physicians, but not something that's going to replace the medical doctor, not replace the person. There's also opportunities for enhanced treatment in a wide range of medical fields. We heard about that already again in terms of cancer and other areas. I'll expand a little bit on oncology treatment and cardiovascular care. In oncology, the quality of images that we have, the ability to manipulate images allows for early detection, the ability to have more accurate diagnoses, the ability to plan treatment more effectively, which naturally leads to improved outcomes. In cardiology, there have been deep learning programs that have been able to detect or predict atrial fibrillation from normal ECGs. Now, this is very important. Atrial fibrillation is strongly associated with stroke, and stroke has a strong association with death. And so being able to use deep learning or being able to use AI to basically predict people who would go on to develop atrial fibrillation and possibly have negative outcomes, this shows the ability for AI to be used for preventive medicine, which can be very powerful. And finally, looking way off into the future in terms of the possibilities that we have, there's also the possibility of a digital twin. A digital twin is a virtual model used to simulate complex systems. And so this is more than just a replica, more than just a model, but it's a real-time system that reacts to information that gets input into it, so we can see how a system would react to different pieces of data or different scenarios. NASA actually used a digital twin when it was, or something similar to that, when it was troubleshooting problems with the Apollo 13 spacecraft many years ago. But looking at this in terms of our health, if we inputted information related to imaging, related to our labs, related to socioeconomic variables, things that we know are associated with health and behavioral outcomes, then AI could help us with engaging in different types of preventive treatment. It could identify when we're at risk for different negative health outcomes and overall help us develop better health and behavioral outcomes over the course of our lifespans. Now, this isn't something that we have right now, but this is the potential that we have with AI. Clinical efficiency. My colleague spoke already about some of the different efficiencies we can have. One of the other areas beyond what was already discussed is also with scheduling. Many systems right now have patient-driven scheduling where patients are able to book their own appointments, but that's something that can be fraught with significant human error. You know, a patient may just select the next available appointment, but they're paired with a physician who's not necessarily matched for their condition. So they go, they see a physician, they see a specialist, but then they have to go back and have another appointment because that person's not the right person they need to see. So it creates delays in their care. Also, the physician who saw that patient, they ended up using a slot for somebody who could have otherwise benefited from that. And so it impacts their productivity as well. So using an AI system where patients fill out a screener that triages them to the most appropriate level of care. If somebody needs to be seen emergently, what physician do they need to see? What appointment dates are available? This has been actually implemented, and it's actually resulted in 20 to 40% reduction in clinic call volume. Also, it helps reduce burnout. The electronic medical record is one of the most significant sources of burnout for people working in the healthcare industry. And so not having the clinic administrators spending as much time on the system doing these appointments can also help minimize burnout for them. Burnout for physicians. We heard about the virtual scribe that AI is, and we even saw a mini demonstration of it. So I'm not going to go into detail repeating that, but there's a significant aspect of helping to reduce clinician burnout. Burnout among US physicians is one of the highest compared to any other field within the United States of America. And the EMR, the electronic medical record, is one of the big sources for burnout among US physicians. So the less time that they spend doing that, the more time, or the less likelihood of having that burnout. But also, as my colleague pointed out earlier, it also increases the time and the availability for the physician to be present in the moment with the patient. So they're able to tend to the person more, be able to hear what's going on and pay more attention and prescribe most appropriate care. And my last piece is facilitating access. We already heard earlier about the study that looked at an AI model for looking at chest radiography and predicting, reading the different images to identify pathology. But this can also be very useful for people who live in remote areas, people who don't have access to specialists, where AI can be used in collaboration with the medical system they have to allow them to have access to people to read their records or get these things done in a much quicker fashion. So they're not suffering, or even worse, they may not be dying because they're able to get their care taken care of in a quicker fashion. And finally, I'm a psychologist. I have to throw a psychology slide in here, right? There's also promises for AI within psychology as well. There have been different studies that have used AI to provide psychotherapy services for people for lower intensity psychological issues, things like adjustment issues, relationship problems, work stress, things along those lines. There was a specific study done, a randomized controlled trial, where they had college-age students who had depression participate in therapy with either a chatbot, or they were given a book that talked about depression in college students and what they could do to address it. And the people who participated in the therapy with the chatbot had clinically significant and statistically significant improvements in depression compared to the people that had the book. So this is important because we've had a strong demand for therapy services, especially since the pandemic, and there's not enough therapists to see all the patients who need to be seen. So this can help address that access issue. But another issue you can address is the issue of stigma. In many parts of the world, there's a strong stigma associated with seeking out mental health care. And if somebody is able to avail themselves of mental health services in the privacy of their own home, not having to go into an office where there's a mental health clinician, it may allow people to take advantage of services that they otherwise wouldn't have considered doing. So a lot of advantages that we can see with AI, but it's also fraught with some potential perils. The technology is developing very rapidly, and our full understanding of it is still limited. But it's not just us as clinicians or as people working in the field that have a limited understanding. Even the developers are recognizing the fact that we don't have a full understanding and awareness of the potential for AI. And so this led the developers to say, we need to have a pause on using systems that are more powerful than GPT-4. And so they had a letter to kind of advocate for stopping further development of systems more advanced than that. And there are approximately 33,000 signers of that letter saying that we should have this pause. The pause never happened, right? But, and actually we went from GPT-4 to GPT-4o. But so that the pause didn't happen, but what it did reflect is a recognition of the fact that this is an advanced technology and there's a lot that we don't know about it. So our perils, again, a number of things that my colleague mentioned. We have a digital divide, right? There are a lot of companies that are very technologically advanced, many that aren't. It's important that we can use AI to try to help advance human care or healthcare and advance humankind. But we want to make sure that this is done equally across all populations. But how do we do that when we have such disparities across all the different countries in this world? There's embedded bias, which was also discussed. All of the programming that's done is done by human beings. Human beings have inherent bias. So what can we do to try to minimize or eliminate that bias in the programming? There's an environmental impact. All these systems require tremendous amounts of energy to use, or to run rather. So what are ways that we can have clean energy to make sure that the environmental impact of these programs isn't causing problems? Privacy and trust, my colleague mentioned this as well. When you think about something like that digital twin, it sounds very exciting, but how much trust do you need to have in a system to turn over all this information about yourself in the system? I don't even sign the back of my credit card, right? Let alone turning over all that information to a system, right? So it requires a high level of privacy and trust. And lastly, liability. If issues come up, where does that liability land? Is it with the maker of the software? Is it with the medical institution, with the clinician? These are all things that we don't have answers for. So in conclusion, some individuals see AI as a threat. Some people are fearful of it, especially because there's so much that we don't know. But the reality is it has great power, tremendous power to transform healthcare for the better. There's a lot of potential challenges with it that we'll learn as we go along, including the fact that we don't have universally accepted guidelines, but those are things that are works in progress. So with that, I'm going to close with the quote that's from Voltaire. Voltaire said, with great power comes great responsibility. And if you ever watched the Spider-Man series, Uncle Ben also said that, but I sound more sophisticated if I quote Voltaire. But I think that there's nothing more appropriate to describe AI than that comment from Uncle Ben or Voltaire, your choice. But thank you very much.
Wonderful. Thank you so much. Our third and final speaker that I will invite to come up to the platform here is Victor Moreno and his presentation on navigating AI from research to advocacy.
Hello, everyone. Thanks thanks for WPA to invite me here today. As you will see, our 3 slide sets, they have a lot of common things, but I think that's positive. We all have the same mindset here when it comes to the future. So I'm gonna gloss over some of the slides that are a little bit repetitive. So you know who I am, so I don't have to go through this. So we are gonna talk on the AI use on health, and we're gonna make an introduction, myth busting. We're going to talk about AI use in pharma research, then AI use in advocacy, and then our favorite topic, which is AI use in patient education and disease management. So first of all, the myth. We have seen this in the past 2 presentations. I'm going to be quick, but AI is not there to replace doctors. AI is there to empower doctors to being able to analyze vast amounts of data quickly, so those doctors have the insights that they need to have a more informed decision-making with the patient. Second of all, AI, they can diagnose with perfect accuracy. That's not true. First of all, AI cannot diagnose. That is always going to be a healthcare professional job. Second of all, AI is as accurate as the data that we feed. Like, I'm going to give you an example. This is not healthcare, but how many of you have been to those like pesky European automated immigration machines, and then you go there and then they say like person not detected, and you're like, what? It's just the AI is not trained on your ethnicity. So AI is as good as the data that we feed it. So this is a call to action to all of you in low middle income countries. There needs to be more participation in AI projects, because there is a clear bias in AI now, and it's an ethnical bias. It's just because some countries have advanced faster in the Western countries, and some countries have not started their journey. So I think this is a wake-up call for everyone to realize that we need to involve more countries in this process. And lastly, as this is a very common belief, that AI is going to make healthcare more expensive. Actually, AI is going to make healthcare cheaper, again, because we have streamlined processes, we have faster, better informed decisions, less hospitalizations, more patient-centric healthcare. So all of that is going to reduce costs in the long term. We are not going to see that in next year, but I talk to you in 5 years, and then we will see. So first, before we go to advocacy, I wanted to go through drug research, because I think that's kind of the beginning of how AI started, the journey in healthcare, right? So we're going to talk about drug discovery, biomarker identification, clinical trial optimization. Very quickly, I know I promise you, we are going to develop a drug in 5 minutes here. I'm not going to take more than that. Yeah, last slide. No. So first of all, the following slides has been granted to me as an in-kind donation by Sanofi Regeneron. Not me or GAP is affiliated with Sanofi Regeneron, and these slides are just for educational and awareness and no commercial purposes. So first, how AI empowered drug discovery. So from targeting those molecules that can potentially benefit a biomarker in a patient, to identify those patients groups that could be benefit from that molecule research. So this is the very beginning of the research. Then this is an example. This is actually a real example from one drug development. So from 10,000 molecules that we analyzed at the beginning, only one of them is going to become a drug. How we streamline that process? That process normally takes years. With AI, have you seen the center stat? With AI, we have managed to reduce, and by we, I mean pharma, I'm not. We have managed to like cut that in half. That means less months of development. That means cheaper research. And they say, why do I care if pharma save money? So a lot of the cost of the medication is associated with the need of pharma to recover that investment in research very quickly before a generic hits the market, right? That's normally the case. So more streamlined, more efficient research always translate to more affordable treatments for the patient. So it's actually a win-win. It's also a win-win for the national health systems and for our governments. So we are in the phase 3 of this. We almost develop a drug here. So from 50 hypotheses here, in this case, AI managed to detect 7 of those who are the most relevant targets hypotheses. They are going to make the pipeline. So we have managed with AI to cut 43 failed developments. So now we have a drug, but the journey doesn't end there, right? Now we go from the strategy to operations. That means from market access to sales. AI also interferes during that process and also streamlines, make it cheaper, make it faster, more efficient. So you see, for how many minutes? 3. So we have a drug already. So now I'm going to talk of the favorite topic from Tonya Winders here, which is the use of AI in advocacy. So this is another real life example. This is the Greto AI. So the Greto AI is an engine that synthesizes research to create detailed audience-specific insights and content suggestions and inform target communication strategies. What does it mean? You know, when you talk to Siri, so this is Greto, I need to talk with the Health Ministry of Mexico about prioritizing COPD in the healthcare. And Greto is gonna analyze all those research, information, material, educational assets, and is gonna create a specific targeted key messaging, simple and efficient for you to use in that pitch with the Ministry of Health. And this is an example, but I hope one day it's real. So now we're going to talk about our favorite topic, I think, from all our audience is how patient organizations are using AI for disease management. So I'm going to present you 2 case studies here. This is the first case study is from Sevilla Respira and Asthma Area. There are 2 small patient organizations in Spain. So they have realized that something that was missing in pediatric severe asthma, management, it was that education, that empowerment of the parents or the caregivers of the children. So they say, how can we do this with AI? Because we cannot go one by one. So they have developed a project that it fits on the patient journey of your child. And then it creates it creates education, it creates awareness, it creates a process for you to follow to improve the outcomes of your own child in severe asthma. And again, this is personalizing healthcare at the very basic level, which is at home. And the last study, I know Migdalia will want to take a picture because it's a project that we co-developed. This is a little bit of promotion of GAP and Latin health leaders. So this is a project that we just created together. This is the pulmonary hypertension multi-stakeholder toolkit. So this is, again, this is a patient journey, it's a platform for patient education, but also connects patients to their healthcare providers and to those reference centers in their own country in Latin America to navigate the system better. Because one of the biggest problems on navigating healthcare in those countries is patients get lost. They say, okay, I have a diagnosis, what now? Who is gonna help me? What is the specialist? So for that purpose, we created this platform. But then we realized, how can this has to be personalized. Healthcare is not one size fits all. So with this platform, the content is actually personalized, synthesized for that specific patient, for that specific country, for that specific region, who is gonna be able to advance to the next step on healthcare by connecting to those healthcare professionals, to that specific healthcare center in that city. So in this case, AI was used for the content creation rather than the monitoring. So this is how you use AI before, during project creation, not during project development. So as I promised, I will be quick. So thank you very much, everyone. I hope you like my presentation.
Great, thank you. So we do have time for questions and answers. So does anybody have a question for any of our speakers? If not, I can kick us off with a question, but I encourage you. We do have time. We did not fall victim to last slide. So we do have time for questions. Actually, I'll start off with a question for Ravi with your psychologist hat on, please. You know, I wonder if you can share some thoughts with us on how we can best support patients who might have digital burnout. We know that for people who there are digital options available, there seems to be a ton of them and they don't always speak to each other. You know, they can kind of get burnt out on one app, but there's another app right here that actually is really beneficial. Do you have any approaches for how we might be able to help people who are kind of have the digital exhaustion?
One of the things that they can do is just to unplug. Take a little bit of time, kind of like this
Yeah.
mic is doing. Just take some time to not connect with anything, to give yourself that break, because that digital burnout can be a very real thing where time after time you're stuck in front of a device, you're looking at a screen, and you can start to feel overwhelmed. You can start to feel helpless at times, and that can actually worsen the situation for which you were initially seeking out some sort of help or support. And so just taking that time to try to unwind or to unplug from the digital devices, giving yourself that space. People may think that, oh, wait a second, if I unplug, then I'm no longer taking time to advance myself in my care. But related to the talks that we just heard before ours, it's an aspect of self-care, right? Because if we keep pushing ourselves forward, we can make ourselves crazy. And so it's important to take that time to unplug.
Great, thank you. Thank you. So yes, wonderful, please. Yes.
You know, I'm sure that nothing will ever replace Dr. Google, right? Dr. Google is everybody's favorite doctor. But what I wouldn't be surprised of is if we see, just like the way we see right now with Google, Google will offer you a summary of search results. Amazon will give you a summary of feedback that people have about a particular product. I wouldn't be surprised if AI actually helps to make some of the comments, some of the information that people get, if it synthesizes it, makes it a little bit more refined. So Dr. Google may actually get some better training.
Great question.
Great, thank you. We have some questions from online as well. I'm not sure who this is for. Oh, well, we have people that are interested in starting a AI diagnostic company for multiple myeloma. So we will connect the speakers with you. That's very interesting. Somebody commented and has a question, and it is that the use of AI is extremely attractive, and I've started using AI myself, and I find it extremely useful, and most importantly for me, it saves time. My question is, what is the risk that AI is going to further shorten doctor and patient engagement? And that's from Faisal, a new friend of ours, and it's a wonderful question. So I will open that up to anyone around the time with the precious little time that patients have with their doctors.
So
Nicole, could you repeat the last bit?
Sure, the very little time that doctors have with patients, and the risk about time being even further shortened with that direct patient and doctor engagement. Like the human engagement is what I think we're talking about, not so much the digital support, but that one-to-one connection that you have with your provider. Please, yes.
So I think it's clear it's the opposite. So a lot of the burden on time on your doctor visits are the doctor having to access those data sets, that information, accessing those very old, outdated systems that we all have and that we have seen here hasn't been changing in 35 years. So I think by AI is going to streamline that those insights of that data. How to say, like it's going to bring that data to the doctor faster. So actually it's increasing the time that you have with your doctor to have that meaningful conversation and have some shared decision making, because that process of the research on the data is already done faster than you would do yourself, right?
Anupam, did you want to add to that?
Yeah, I would echo that as well, because, In the traditional way, if a physician who's on a paper chart or even in a digital chart, you're seeing patients every 15 minutes, and you don't have the time to understand the patient history so quickly. And I think, in fact, AI is going to make it super easy that within seconds, you can get the context of, what could be the factors, that are not in front of you, that were in the patient's, medical, like, let's say, family history, that were in the previous issues patient encountered in the past, or previous data results that, physician did not have chance to look at the trend of certain, let's say, lipids or etc. So all of that is actually going to shorten and allow physicians to spend that one-on-one time to engage with the patient, empathize with the patient, and listen to the story of what is happening around the patient's, social determinants of health. What's happening at home, what's happening at work, what's happening, what happened during vacation that could have contributed to what the patient is here for. So I agree that it's actually the other way around.
Thank you. Anything to add? I'll move on. We have a question from Bangladesh looking for resources, looking particularly overseas. What type of technical skills development? Where can people go to get more training? Are there any associations? Where could you point people in the right direction? This is for anyone.
I think there are tons of resources. I would say, there are, even if you start with the IBM website, there are some great free courses on the basics of how, about AI. And then, there's also, Coursera and LinkedIn Learning, and there are many learning tools, Udemy, where there are courses that could help you get to a point. Then I think a lot of it is self-learning. I think not just with AI, even previous technology revolutions, people self-learn more, but you do need to get some basics. And I think there are tremendous. So I would say just go to ibm.com, and then there is a great course that can help you get started.
Great, thank you.
Others, Ravi or Victor, any other feedback?
Yeah, so I think, so AI is a very novel field. So there is not like so many like official institutions that are offering that, formation on AI master. It's still a lot of people throwing things to the wall and see what it sticks. So, but I have seen from the patient advocacy side many efforts in trying to educate and implement that with the patient communities. Like we in GAP, we have a podcast on that topic, but there is not a lot out there, and not everything that you will find will be legit. But I think it's the same that when we started with digital health, you need to test few things, and not all of them are going to be great. But at the end of the day, you will find that that is going to suit your education.
Thank you. We have a question in the room.
Thank you so much. My name is Dr. Innocent Peter. I'm a medical doctor and a cancer researcher from Tanzania. I am affiliated with Kilimanjaro Clinical Research Institute. I'm much interested into AI diagnostics, and we are currently working on a AI tool that is going to digitalize pathological reading of the cervical cancer smears, so that we are able to read them in less than 10 seconds, navigating the one that we have now that could take up to 6 months. My question is, the AI are really going to revolutionize healthcare, and especially in addressing the health equity that we have. So it's basically, how do we make sure that the AI is not, because like right now we have a problem in providing access to the healthcare services to the people in rural areas, to the people that cannot access these services. And now we are bringing into AI that is benefiting people with access to technology. And so we are kind of leaving those people with no access to technology. How are we navigating around this, making sure that even those people who do not have access to technology are going to benefit from the AI that we are developing? And this also stems from the point of even we are also advocating for local solutions. So how are we even capacitating local researchers, for example, to have AI tools that can communicate in a language that people from South Africa, people from Tanzania who speak Swahili can understand and information can really get to them. Thank you.
Who would like to jump in? This is a tough question, of course, not easily solved.
Not easily solved, agree. I think, but it's important, again, as I said earlier, it has to be a collaborative approach. We can't just use what is given to us, which means that, you have to bring the local aspect to it while training the AI. So AI algorithms have to be trained on local data, not on data that doesn't, make a difference, right? So, while we are all same, and from a biological perspective, there are a lot of local aspects to it, including the language. So the tools have to be multilingual support. They have to be simple interfaces. And in my philosophy of product, I've always said, no interface is the best interface. And I think, easy to use, multi-language support, and AI is trained on local data would be some steps to make sure that, it would work. But ultimately, if a patient doesn't have access to technology at all, you can't give them direct access to AI. There has to be a mediator, sort of, patient advocate who uses that AI to bridge that gap. Is one of the proposed solutions I have in my mind. My colleagues, any other thoughts?
I was going to reinforce the idea of having partners in the community who can help with that, local partners that are trusted members of the community, especially when there's a language gap. But also there needs to be a lot of education, because AI is something, for example, even in this room, right? Many individuals still have a limited understanding of, well, what exactly is it? How does it work? And so you can imagine that particularly in these areas where you're trying to roll it out, there can be a lot of confusion about it. So having local individuals, local partners who are able to speak in the native language and help people better understand what's going on and how they're getting their care, that's going to be a very critical part for it to be effective, for people to have trust in it.
Thank you. Absolutely. Thinking back to the digital twin, which is a very cool idea, but also I think can produce some anxiety, putting a lot of trust into AI. What are some ways that patient advocates can ensure that AI, that patients' lives will not be harmed, right? It's such a scary thought to think of. This is great when it works, right? And that's like when then we looked at the slide of the perils, because there's so much at stake. For many patients, we're not talking about a small aspect of quality of life, potentially directing somebody to the wrong treatment. How do we kind of address this, but keep it balanced so that we are moving forward and don't let the fear of the unknown stop us?
I think we saw a similar, oh, go ahead.
It's okay. Go ahead, please.
So I was going to say, I think we saw a similar type of thing when we saw the advent of the electronic medical record. There was a lot of distrust about it, that, oh, I don't want to have all my information in a centralized place. Who's going to have access to it? There was a lot of distrust. Who's going to see it? Where's it going to be stored? But over the course of time, it's just become kind of the standard of care. And people are like, if you don't have an electronic medical record, why are you behind the times? And so I think there's naturally going to be some of that distrust that comes. And it's going to be something that probably evolves as people are able to see the benefits that they get. But there will be, it's going to be a shift. It's going to be a cognitive shift that all of us have to make. And it's not going to be an easy one at first.
So if I can complement my colleague here. So there is this trust not only from the patient, it's this trust from every single stakeholder that is using AI, right? So I think Europe was the first continent that actually has an agency that regulates AI. And in Europe, the US, Australia, other countries, we have very strong data protection laws. So we can manage, we can use, and we can use data as a currency in a sense. But not every country in the world has this development in this legal development yet. So it's very difficult for investigators or for companies to engage in AI if they don't have a legal framework to do so, because you need to engage legally and acquire the data in a way that will be compliant with that country. So I think part of the problem is the lack of advancements in legislation on that. And I understand it's a very new thing, but I think every country should be working on this to not, fall out of the train.
Anupam, did you have anything to add?
Yeah, I would say that, first of all, to make it reliable, it needs to be real world. It needs to be on real world data, and it needs to have real world testing as a necessary step to make sure that it is reliable from the get-go. But also, oversight and audits, right? Human oversight and audits have to be there, not to just blindly accept and use, because AI can produce hallucinations. We have learned that it is very capable of, creating its own reality. And so it's important that there are much stronger human oversight on it. And lastly, if this AI is explainable in, real layman language, to the users, so they understand why, it is saying this, and that would really build that trust, build that conversation, because we need to really have that conversation with the data, with the conversation with the, because it is learning and it's iterating, so it's not fixed at any point of time. So that's why it is a huge responsibility on us to not let loose AI, but at the same time, we can have all these measures along with what my colleague said to really safely use it for our advantage of humanity.
Great, thank you. We have a question in the room.
Tanya Winders, president of GAP. So I agree fully that data is one of our most valuable assets as patient advocacy organizations, and that we leverage these tools in appropriate ways. I also agree that change happens at the speed of trust. And so it's incumbent that we build that trust within our community in providing their data. Thirdly, words matter. And I saw consistently in your slides, Ravi, that you use that you use the words deep learning rather than artificial intelligence. Can you expand as to maybe why you've chosen that verbiage and the words deep learning rather than artificial intelligence?
So use deep learning. There are different types of AI. There's the deep learning programs, which basically read information. Then there's a generative AI, which produces a response. And so the deep learning, because this wasn't generative AI in the studies that I had used, and so just to eliminate any kind of ambiguity was the reason I used deep learning.
Great, thank you. So this time I'll invite you to come up and share.
Right, thanks, Nico, for moderating, and thank you to everybody for your enthusiastic questions. Yeah, we have to fully understood about the whole thing about the digital divide that we were talking about, as well as the have and the have not, together with a separation of global north and global south. These are some of the challenges that we are all facing. So let me just do a quick summary of our three speakers' presentation. So the first speaker, Anupam, talked about the future of artificial intelligence in healthcare. And of course, he has highlighted how AI can significantly enhance healthcare system by improving diagnostic accuracy, treatment options, and system efficiency. Especially, he was sharing with us about the AI tools in Mayo Clinic, Vuno, and of course, Tempus. And of course, he have also pointed out about the AI potential to analyze the vast amount of data quickly, which supports healthcare professionals in decision-making. However, he cautioned about the challenges like the ethical use of AI and overcoming technical hurdles, which must be tackled to ensure its full potential is realized according to, like example, like drug discovery, reactive care to preventive care. Our second speaker, Professor Ravi Prasad, talk about also about the ethical dimension. You go a bit deeper into the AI in healthcare. He discussed both the promises and perils associated with AI and focusing on the concerns about privacy, bias, and of course and also the absence of globally recognized ethical guidelines. And of course, Ravi also talked about the various efforts like those by the World Economic Forum to develop some of the ethical frameworks for AI implementation that prioritize fairness, transparency, and the safeguarding of human dignity. So our third speaker, Victor, talk about the insights into AI from a patient advocacy perspective. He provided examples of how AI is currently being used to improve patient education, disease management, and communication between patients and healthcare providers. So he has showcased 2 case studies. So using AI-assisted asthma care, Moreno demonstrated, of course, Victor demonstrated how AI can empower patients through personalized care and better self-management. So some personal thoughts as a psoriasis patient advocate. So as a patient advocate for psoriasis, I see great potential for AI to revolutionize patient safety and the quality of care. AI can be leveraged to create personalized treatment plans, enhance medication adherence through predictive algorithms, and monitor patient progress in real time, all of which are critical for managing chronic conditions like psoriasis and the others. Moreover, integrating AI into the QALY, which is of course quality adjusted life years equation, particularly by incorporating productivity elements, could offer a more holistic measure of patient well-being. So for patients, AI-driven tools that enhance work productivity, manage flare-ups, and improve overall quality of life would be transformative, allowing for more meaningful assessment of health outcomes that go beyond traditional clinical measures. Finally, this would not only improve the accuracy of quality calculations, but also highlight the true impact of treatment of a patient's ability to lead a productive and fulfilling life. With this, thank you everybody, my moderator, as well as our 3 speakers. Give them a round of applause, ladies and gentlemen. Thank you very much.